In more than 60 Iowa counties, you won't find one obstetrician or gynecologist, and certainly no one performing abortions. That's a problem for Planned Parenthood, and a major reason it's investing in telemed abortions. Former Planned Parenthood Director Abby Johnson and other pro-lifers say there's no doubt the national abortion provider is looking at its bottom line. With this technology, it can pay the doctor less and get more results.
If they can find a doctor who's a private practitioner but has an hour during lunch that can get on his computer or get on his BlackBerry and authorize a few abortions, they don't have to have a doctor on site.
Telemed abortions also solve another problem for Planned Parenthood, a shortage of doctors willing to perform them. But the biggest debate right now is this: are they safe? Iowa pro-life leaders Maggie DeWitty and Jennifer Bowen learned of Planned Parenthood's plans for their state 2 years ago when an employee called the office.
They were going through the training for what would become webcam abortions, and she was very, very scared, very, very upset by the lack of safety.
Planned Parenthood says telemed abortions are needed in more rural areas like Newton, Iowa, where there is no abortion doctor. But pro-lifers say that's just the reason why it's a bad idea, because there is no doctor here.
It's much easier on the abortion provider, but much more difficult on the woman.
Dr. Donna Harrison heads the American Association of Pro-Life Obstetricians and Gynecologists. She says telemed abortion is one of the most dangerous ways for a woman to end a pregnancy.
The CDC looked at the risks of dying from an RU46 abortion, and it was tenfold greater than a surgical abortion.
This footage from an Iowa TV station shows a mock telemed abortion consultation.
Good morning, Laura.
The doctor meets the patient over the internet after a nurse practitioner does a physical exam and a sonogram. After discussing the abortion and possible side effects, the doctor pushes a button, releasing a drawer with the abortion pill RU486. The woman takes one pill right then and another at home the next day.
Planned Parenthood is touting this as it's so much better. You'll have your miscarriage experience in the comfort of your home. And are they really allowing these women to understand that they are going to deliver a dead child?
Mifeprex is the trade name for the first abortion pill the woman takes. And on its own website, Mifeprex says its failure rate is 5 to 8%. That means 5 to 8% of women taking this drug will need surgery to safely end their pregnancy or to stop heavy bleeding. It's a tough call for a woman alone at home working through a telemed abortion.
She is on her own to figure out how much is too much bleeding, how much pain is too much pain, how much cramping, and what kind of physical trauma is too much.
Planned Parenthood in Iowa refused CBN's request for an interview on telemed abortions, but last month on National Public Radio, its vice president for medical affairs vigorously defended them.
There's absolutely no evidence that medication abortion through telemedicine is in any way dangerous.
Of course, there's no required tracking of abortion complications in Iowa emergency rooms. That's what the State Department of Health told CBN News when we asked. It's true nationwide as well. A 2006 congressional report noted that emergency rooms have no obligation whatsoever to report adverse events for RU486, even assuming the healthcare worker knows what happened. And they might not, since the abortion pill's side effects often mimic a natural miscarriage. More than 2,000 telemed abortions have already been performed here in Iowa, but Planned Parenthood says it won't stop here. It's telling supporters it plans to go nationwide with this new model.
They seem to think that if it can pass in the heartland, in the Midwest, then it can pass anywhere.
Iowa pro-lifers like Steve Brody say they want to stop telemed abortions before they go out of state. During their annual lobby day this month, Iowa pro-lifers gathered in the Capitol with a major focus on telemed abortions. Their strategy, a bill that would require doctors prescribing RU486 to meet the patient in person.
This is about the health and welfare of that mother and the concerns that are legitimate concerns
Pro-life advocates across the country say other states should consider such legislation now and stop telemed abortions before they become a national trend. In doing so, they could save the lives of countless unborn children and protect the health of their mothers as well. Reporting in Iowa, Heather Sells, CBN News.